Good day to everyone, and thank you for joining us. I am Bob Blancato, the National Coordinator of the Defeat Malnutrition Today Coalition. I'm going to defer my opening comments to allow our special guest to get right to her comments and make her other commitments. It is my distinct professional and personal pleasure to welcome Representative Suzanne Bonamici. She represents the 1st Congressional District in Oregon and is in her 5th term. Of special importance to both our Defeat Malnutrition Today Coalition and Aspen is her work as the chairman of the Subcommittee on Civil Rights and Human Services of the House Education and Labor Committee. In that capacity, she was the author of the 2020 Older Americans Act reauthorization, one of the strongest reauthorizations in the 55-year history of the Act. It strengthens the largest program in the Act, nutrition programs. Of particular relevance were her provisions to add first-time malnutrition screening to the Older Americans Act. Congresswoman Bonamici has also been leading the effort to ensure the Older Americans Act nutrition programs receive much-needed emergency funds during this pandemic, both now and in the future. So Congresswoman Bonamici, welcome, and please proceed.
Thank you so much, Bob. Thank you for the kind introduction, and thank you to Aspen and the Defeat Malnutrition Today Coalition for this invitation. I'm really happy to join you this morning, this afternoon, I guess if you're on the East Coast, to participate in today's briefing, and importantly, to support Malnutrition Awareness Week, an opportunity to call attention to the challenge of malnutrition, especially among older adults. According to the Defeat Malnutrition Today Coalition's 2020 National Blueprint, the disease-associated malnutrition in older adults is estimated to cost more than $50 billion every year. 56 million of that annual economic burden occurs in my home state of Oregon. Much of that is a result of longer hospital stays, which research shows can be up to twice as long for those with protein-calorie malnutrition. And in addition to the financial costs, we must consider what malnutrition does to quality of life. And we're talking about something that is preventable, so I applaud you for your work. As Bob said in that kind introduction, I'm honored to chair the subcommittee overseeing the Older Americans Act. And as the lead sponsor of the recent bipartisan renewal, I'm glad to tell you that we did include 2 important provisions related to malnutrition in this new law. First, we added, as Bob mentioned, reducing malnutrition as a specific purpose of the Older Americans Act nutrition programs. And we also included that first-time screening for malnutrition as part of a broader nutrition screening so service providers can better target and address malnutrition. And I must say that we're in a pandemic, and the pandemic has increased concerns. The rate of food insecurity is quickly rising for far too many. That increase in food insecurity is why earlier this year, we secured $750 million in emergency funds for OAA nutrition programs. And now that congregate programs are not an option, the move to all home delivered meals has increased, it's led to increased food, transportation, and personal costs. And demand has skyrocketed in many communities. I know a lot of people and communities and organizations are stepping up, but there's a lot of need out there. This is a really critical issue. We know we need to do all we can to fill that gap to meet the nutritional needs of our seniors, but also provide social contact to check on individuals to make sure they know that someone cares about them during these times of physical distancing. And I do want to report that the updated HEROES Act, the legislation that passed the House of Representatives just last week, includes an additional $500 million for the Older Americans Act nutrition programs. I call on the Senate to join us in passing this critical relief package and doing it now. So thank you again to Ainsley Malone from Aspen, my friend, Bob Blancato, for inviting me to join you today. I hope you have a wonderful conference webinar, and thank you for your advocacy and all you do.
Thank you very much, Suzanne. Very much appreciate you being here and your leadership, and we look forward to our continued work together. And
likewise, thank you again.
Take care, everyone. Take care. Okay. So we are pleased to have this dedicated webinar for Malnutrition Awareness Week, which is our annual opportunity to spotlight both national, state, and local attention to the problem of malnutrition, especially as it relates to older adults. The Defeat Malnutrition Today, 107 members strong, is pleased to co-sponsor this webinar with our friends from Aspen, and you'll hear from Ainsley shortly, who are the founders and creators of Malnutrition Awareness Week. One of the highlights of this year's and last year's Malnutrition Awareness Week was the introduction of a bipartisan resolution in the Senate officially recognizing Malnutrition Awareness Week. We are honored today to have the principal staff professionals who have worked on this resolution join us today. I will introduce them shortly. Please get familiar with Senate Resolution 716. Memorize it, because later you will see a current list of bipartisan co-sponsors. If you don't see your senator on there, make contact and request that they become co-sponsors. The more the better. The more the co-sponsors there are, the better the chances are for this resolution to pass when the Senate returns the week of October 19th. So first, let me introduce Sarah Shapiro, the legislative aide to Senator Chris Murphy, the author of the resolution this year and last. And Sarah, please, we welcome you.
Thanks, Bob. It's great to join you all today. I'm just making sure you all can hear me okay.
Yes.
Great. Well, first of all, thank you to Aspen and to the Defeat Malnutrition Today Coalition for hosting today's webinar. And it's been great to lead this resolution with Senator Grassley's office and to have the opportunity to bring awareness to the fact that malnutrition is a very real problem in the United States. And when we first introduced this resolution last year, you know, it's really taken on a whole new meaning as the coronavirus pandemic has undermined access to quality nutrition. From lockdowns to school closures and other economic restrictions, it's impacted everything from production, transportation, and the sale of nutritious, fresh, and affordable foods, which has forced millions of families to question not only if they'll be able to put any food on the table, but also when they can scrape by, if they're going to have access to healthy, nutritious foods. And we know, as the Congresswoman talked about, skyrocketing rates of malnutrition, you know, since July, the number of people who said that they sometimes or often did not have enough food has skyrocketed to 29 million, or 11% of adults in the United States today. That's just an unacceptable number. And we know that this pandemic has disproportionately impacted our most vulnerable populations, including seniors and children. You know, the number of American children who sometimes don't have enough to eat is 14 times higher than it was at this point last year. And 1 in 4 seniors are considered to be socially isolated, meaning that they're now being asked to stay indoors and socially distance, making it that much more challenging to access nutritious food. And so it really just brings a new call to the importance of passing this resolution. And just as Bob mentioned, I would add to his call to encourage the senator in your state to co-sponsor this resolution. We're at 20 and counting, but happy to provide my contact information to any advocate that wants more information. And then, of course, would also echo the Congresswoman's support for the HEROES Act. We continue to call for additional relief that's highlighted in the resolution. But my boss would also, you know, continue advocating strongly for increasing monthly SNAP benefits and the maximum SNAP benefit amount, providing additional options for delivery for SNAP participants, and continued expansion of food delivery for services for seniors, additional WIC funding, and additional emergency food assistance program funding, or TFAP, to assist all of the food banks across the country that are facing shortages. So there's a lot to do. We continue to push for relief in the Senate, and again would urge you to reach out to your senator and ask them to support this resolution. Thanks so much.
Thank you very much, Sarah. Appreciate your leadership and Senator Murphy's leadership as well. Now it's my pleasure to introduce a very close friend and colleague, Evelyn Fortier, who's the General Counsel for Health Policy and the Chief Counsel for Special Project of the Senate Finance Committee, working for and chaired by Senator Charles Grassley of Iowa. Evelyn?
Thanks, Bob. I appreciate the opportunity to participate in today's webinar, and I too want to thank both Aspen and Defeat Malnutrition Today Coalition for this kind invitation. As already mentioned, for the second year in a row, Chairman Grassley is co-authoring a resolution to recognize Malnutrition Awareness Week with Senator Murphy, and we're pleased to now have nearly 20 bipartisan co-sponsors on this year's version, which is SRES 716. As Bob mentioned, please encourage your senators to co-sponsor if they haven't already. We introduced this resolution to spotlight attention and awareness about the growing impact of malnutrition, especially among older adults. Senator Grassley's been a champion of measures to help prevent elder abuse and exploitation in the past, and this is a natural outgrowth of that work. According to the 2020 National Blueprint by the Defeat Malnutrition Today Coalition, 1 in 2 older adults is either at risk of becoming or is malnourished. And in Senator Grassley's home state of Iowa, also according to the blueprint, the economic burden of disease-associated malnutrition in older adults is over 41 million a year. The pandemic has created new concerns, especially with the rate of food insecurity, which is a precursor of malnutrition. And Feeding America estimates that we have seen a doubling of food insecurity since the outset of the pandemic. On behalf of Chairman Grassley, I also want to note that he was a very strong supporter of the 2020 Older Americans Act reauthorization. He co-sponsored the final version, which contained language for the first time to authorize malnutrition screening within the preventive health title of that act. And also wanted to note that the Older Americans Act nutrition programs have received $750 million in emergency funds under the Families First and CARES Act, which are 2 relief packages that Senator Grassley supported, and this underscores their importance. We also hope that CMS will continue its work on malnutrition clinical quality measures. And with that, I want to close by again thanking Bob Blancato and Meredith for all the work they do to help Aspen and Defeat Malnutrition Today Coalition. And I also want to thank the Academy of Nutrition and Dietetics for their leadership on this issue. Thank you.
Thank you very much, Evelyn. I appreciate your leadership as well. Now it's my pleasure to introduce the co-sponsor, my partner in crime, so to speak, in this work, Ainsley Malone, who is the nutrition support dietitian at the Mount Carmel Health System and clinical practice specialist with Aspen, but more than that, a tremendous advocate for the cause of malnutrition in our country. So Ainsley, it's all yours.
Thank you, Bob. Thank you, Bob, so much. And thank you, Meredith. And I want to thank the representatives from Senator Murphy's and Grassley's office for your great presentations and remarks. And also thank you for all of your effort in the work that you've done with the resolution, both this year and last year. And just really exciting that this is coming to fruition, hopefully, keeping fingers crossed. And I apologize, Meredith or Bob, am I able to advance my own slides or do you need to do that?
I can make you the presenter. Hang on.
Okay, perfect. I have a few, so it might be easier then for me to just keep asking you to advance the slides. Actually,
Oh, that's
not
not
good.
okay. Here, I'll take it
Why
back.
don't I just ask you to advance the slides? How's that?
That works for me.
Okay. Thank you. So now you can move to the next slide.
Okay.
Many of you may be familiar with Aspen, but if not, just to give you a little bit of background, Aspen is an organization that is dedicated to improving patient care by advancing the science and practice of clinical nutrition and metabolism. Aspen was founded in 1976 as an organization comprised of interdisciplinary members who are involved in providing clinical nutrition therapies, including parenteral and enteral nutrition. Aspen is over 6,000 members strong from around the world and is comprised of a community of dietitians, nurses, pharmacists, physicians, scientists, and students, along with other health professionals from every aspect of nutrition support, clinical practice, research, and education. You can move on, Meredith. Malnutrition Awareness Week was launched in 2012. It seems like it's just been a few years, but it's incredible how it's grown in the last 9 years. It was initiated in 2012 to really begin to try to raise awareness of malnutrition both within the healthcare setting and outside the healthcare setting. It has been on the National Health Observances calendar for years. The week is comprised of educational webinars along with offerings that are non-continuing education events, such as videos, posters, one-page resources for clinicians, as well as for consumers. We embarked on an ambassador program early in Malnutrition Awareness Week, and at this point, we have over 100 national and international organizations, which is incredible. And this year alone, over 1 million individuals will receive access to all the different educational offerings. This year, similar to last year, we have partnered with the Canadians as well as the United Kingdom to offer additional webinars as well as other educational projects. There is a website for Malnutrition Awareness Week, and you can see the URL on the slide. That includes a toolkit as well as all the resources that have been developed over the years for this event. If you could advance, Meredith, thank you. One of the critical aspects of Malnutrition Awareness Week is to raise awareness as to why malnutrition is important and the fact that it can exist without anyone truly recognizing it. And I think many outside of the healthcare arena, as outside of the community setting, really think of malnutrition as something that happens really in third world countries and developing countries. And those are the images in their mind, but really malnutrition can impact anyone, especially if there's a disease involved, especially in an individual that is food insecure and some of the things that we have experienced with the pandemic, as well as other issues that are similar in nature. It is often underdiagnosed, and as I mentioned before, can be very deceiving. Meredith, if you can advance. It's a very important aspect, and specifically at the federal level, you've heard a great deal of information from the previous folks as well as our congressman. Selected studies and populations really don't paint the greatest picture because it tells us that 20 to 50% of hospitalized patients are at risk of being malnourished. And what we at Aspen have wanted to do is utilize national data to help us really define the story in a more meaningful way. If you could advance, Meredith, thank you. So Aspen partnered with AHRQ in 2018 to look at data from 2016 on from the national inpatient sample that represented hospital discharges. And what was identified that there were 2.2 non-maternal, non-neonatal inpatient stays that were related to malnutrition, which represented about 8.1% of the total, almost 28 million stays not related to maternity or neonatal stays. And when you compare that with the 20 to 50% that I mentioned before, we have a ways to go. And this is why the recognition of malnutrition is so important and the awareness. The most common type of malnutrition was protein calorie malnutrition, representing almost 1.5 million malnutrition related stays. And of those that were diagnosed with protein calorie malnutrition, almost 2/3 had Medicaid as their payor. If you could advance, thank you. That data was turned into an infograph. Aspen has created two infographics. The one on the left basically identifies key metrics of that data, that individuals who are malnourished are 1.6 times higher of being readmitted to the hospital. It carries a $49 million price tag. It results in about twice as long as needing to stay in the hospital compared to an individual who is not malnourished. And this is significant as well in the older adult because the older adult is more likely to experience malnutrition and have all of these subsequent issues. The infographic on the left actually looks more closely at some of the racial and income disparities. And this was asked by colleagues at the briefing last year. And so we put together this information that essentially shows that Black individuals are much more likely to experience malnutrition, as well as those from a lower income level. And I would imagine as we look into this in more depth following COVID, we're going to see even more remarkable disparities. If you could move on, Meredith, thank you. An important part of Malnutrition Awareness Week is to provide outreach and educate consumers. And so about 6 or 7 years ago, we created this poster, Ask About Your Nutrition, and really gearing it for the consumer or the individual not involved in healthcare. This has been translated and is available on our website. It's translated into 6 different languages and dialects. One more slide, or a couple more actually. Another thing that we added this year was the creation of these, I guess, educational pieces, not necessarily geared for the layperson, but geared for a clinician or someone working in healthcare or outside healthcare that is not well versed in nutrition. And so these tools were created to really provide key facts about malnutrition, as well as what the clinician should do. And these were geared towards 3 different populations: the older adult, the individual with cancer, as well as the individual who is in an ICU. One more slide, Meredith, thank you. So with all that information, I want to thank everyone for their support in both co-sponsoring and introducing Senate Resolution 716, as we heard Bob say. You need to memorize that. Aspen appreciates all the co-sponsors, and I would encourage all of you to reach out to your senators so that they can co-sponsor this important legislation. I have reached out to my Ohio senators on more than one occasion, and I'm hopeful that we'll see some support from them. So with that, I want to turn things back over to Bob and Meredith. Thank you, Meredith. There's one more slide that you can just gloss over. Thank you.
We always like to have those resource slides up so people can jot the extra notes down. So
Thank you.
Thank you, Ainsley, for the years of work on this. And it's been our pleasure to partner with you over the past few years since the creation of the coalition, of which you guys are very important members. So we appreciate that as well. It is now my pleasure to introduce another friend and colleague, but someone with a new role in life, and a very important role in life, Judy Simon, who is the National Nutritionist for the Administration on Aging, which is part of the Administration for Community Living. But Judy comes to this position with years of experience and leadership in the state of Maryland, working on many, many nutrition issues. She's someone that we have relied on for years for input and advice, and now in her new role, we'll be working with her as they work to implement the 2020 Older Americans Act legislation that's been referred to. So with that, Judy, welcome.
Thanks so much. It's great to be here, and thanks to Aspen and Defeat Malnutrition Today for inviting ACL to speak today about the issue of older adult malnutrition awareness and intervention, and to highlight the work being done throughout community-based organizations serving older adults. I'd first like to introduce our attendees today to our national network of community-based programs for older adults, tell you a bit about what we're seeing in the community related to malnutrition risk, and then finish up with a summary of collaboration ideas to address malnutrition in older adults across the care spectrum, from community to hospital, and then, as typically is the case, back to the community. So as an introduction, many of you may not be aware of the Federal Administration for Community Living. ACL funds services and supports that are provided by networks of community-based organizations across the nation. And we also have investments in research, education, and innovation. ACL's Administration on Aging works to ensure that older adults stay independent in their communities by awarding grants to the Aging Network, including states, tribes, and local community organizations. The Older Americans Act is the primary legislation through which AOA funds services, and the intent of the Older Americans Nutrition Program is to reduce hunger, food insecurity, and malnutrition, enhance socialization, and promote health and well-being within a coordinated network of services and supports. And as Representative Bonamici mentioned, reducing malnutrition was newly added as an intent of the Older Americans Act via the 2020 reauthorization. Older Americans Act meals have no income qualifications, and while there are no fees, a voluntary donation is requested. The meals we provide meet the dietary guidelines and the dietary reference intakes, and senior nutrition programs provide nutrition screening, education, and counseling. So let me share with you what we're seeing in the community. During the COVID crisis, legislation has allowed for flexibility and funding, but also flexibility around meeting these core nutrition standards. And the cornerstone, of course, for healing or preventing malnutrition is a well-balanced, healthy diet with sufficient protein. Foods high in sodium or sugar can trigger negative health consequences, impair control of chronic disease, and as you can imagine, do not help to address malnutrition and can even cause significant harm to a population that's already quite vulnerable. So ACL continues to strongly encourage our network that should food availability be sufficient in your location, to continue serving meals that meet these well-established federal nutrition standards. The Senior Nutrition Meals Program is a national program, and it reaches a considerable number of community-based older adults. For example, in FY 2018, our home-delivered and congregate nutrition programs nationally served approximately 226 million meals to 2.5 million individuals across a variety of community settings. Prior to COVID, the Aging Network was already reaching vulnerable seniors, many of whom face malnutrition, food insecurity, and social isolation, as well as chronic disease at higher rates compared to populations not receiving our services. And these widely available community senior nutrition programs are having an impact. For example, 80% of participants in the congregate meal program believe their health has been improved as a result of the program. Participants in the congregate meal program have fewer emergency room visits, leading to admissions and also fewer hospital admissions, both by nearly half compared to non-participants. Meals on Wheels clients have lower hospitalization rates, emergency department rates, nursing home use, and reduced Medicare expenditures after starting Meals on Wheels, and these impacts last for at least 6 months after starting the program. For every $25 per year per adult that states spend on home-delivered meals, they reduce their percentage of low-care nursing home residents by 1% compared to the national average. Since COVID hit in March, on average, our network is serving 77% more clients than previously and 47% more meals than before. Specifically, we've moved meals that involve group dining together to drive-through and pickup meals. We even have some programs offering eating together via video, so people don't have to eat alone. We've gone from home-delivered meals delivered daily by a volunteer to less frequent and contactless delivery that still provides a safety check. Our programs are focusing not only on getting food to seniors, but remembering that providing socialization, promoting physical activity, and supporting mental well-being are vital to efforts to improve nutritional health for older adults. For example, we've moved from in-person nutrition education to virtual nutrition education, including reaching people not only by computer, but also by phone. Exercise classes have been able to resume either outdoors or limited attendance indoors, and also online classes have emerged, including evidence-based health promotion and falls prevention workshops, often through what are called virtual senior centers. So how can we collaborate across the care spectrum moving forward? As we address the holistic needs of seniors, their caregivers, and families, we recognize the importance of partnership with the Emergency Feeding Network, professional organizations like the Academy of Nutrition and Dietetics and Aspen, coalitions like Defeat Malnutrition Today and others, USDA food programs, along with local efforts to partner with housing authorities, healthcare, and government entities, as well as the business community. One workshop I'd like to briefly share with you is Stepping Up Your Nutrition, a one-session malnutrition awareness workshop for community-based older adults, designed by dietitians and other health professionals, and delivered by trained lay leaders. The program provides information on the link between malnutrition and falls risk, explains how nutrition is related to strength, and has a focus on eating enough protein and adequate hydration. It also has an embedded malnutrition risk screening tool, resources for referring people at high malnutrition risk, which mostly revolve around community and social determinants of health interventions, and an optional hand-grip strength training designed by our esteemed colleague and fellow dietitian, Cherise Schollard. Out of over 600 older adults offered the program, 71% screened at high malnutrition risk using the Screen 2 tool developed by Dr. Heather Keller. People at risk are provided individualized referral options varying from diabetes self-management classes to local food pantries, economic supports, including SNAP, transportation options, exercise and falls prevention classes, and more. Every attendee creates their own personalized action plan to address their malnutrition risk factors and receives a letter to communicate their results and action plan with their physicians. In some cases, where available, the results are documented in a regional health information exchange, or healthcare providers receive secure communication that documents the identified risk along with referrals made. And that's not all. Nationally available nutrition education geared towards community-based older adults abound and includes work by a number of our Aging Network colleagues. For example, Pam Van Kampen at the Greater Wisconsin Area Agency on Aging has designed Eat Well, Care Well program for caregivers and the Eat Well, Age Well program for general adult audiences. Fresh Conversations is an excellent research-based collaboration between the Public Health and Aging Network in Iowa, supported by SNAP-Ed funds, which is now available throughout several states. And the Healthy Eating for Successful Living program was created by Jennifer Raymond at the Massachusetts Healthy Living Center of Excellence and is a terrific multi-session workshop series focused on consuming, purchasing, and preparing healthy meals. There are also community-based dietitians like Shauna Marceau at Meals on Wheels of Central Texas, who have a team of RDs working, performing malnutrition screening, nutrition counseling, and service provision, and doing a great job measuring the impact of these community-based interventions. ACL acknowledges that nutrition plays a critical role in community living as we age. Good nutrition can help older adults stave off illnesses, avoid or shorten hospital stays, and remain active and independent. We also know that there are a number of challenges for maintaining good nutrition, and far too many older adults are at risk. To recognize Malnutrition Awareness Week, ACL has developed ready-to-publish articles about the unique nutrition challenges faced by family caregivers, one with tips for taking care of an older adult's caregiver's own needs, and one with strategies for helping ensure their loved ones are eating well. In addition, the Senior Nutrition Program, the ACL Office of Nutrition and Health Promotion funds 3 national resource centers, one focused on falls prevention, another on chronic disease self-management, both located at the National Council on Aging website, and also the National Resource Center on Nutrition and Aging, hosted by Meals on Wheels America. The National Council on Aging has a community malnutrition resource hub that contains actionable resources for community-based programs. There's much we can do in the community to partner with hospitals and outpatient and community-based healthcare partners. These resources may be helpful in your malnutrition awareness and prevention work, and we hope you will share your materials with us as you're developing items for consumers or professionals. No single network can do the job alone. It's critical that across the board, we move toward intentional partnerships to effectively meet the significant and growing needs of community-based older adults. Thank you for your generous time and attention.
Judy, thank you very much for a great presentation. I actually took a lot of notes, which is unusual for me, so I give you special credit for presenting such good information. And while I'm at it, let me take a moment to, on behalf of the coalition, appreciate the leadership of some of your colleagues, led by Lance Robertson, of course, at ACL, Edwin Walker, and Kerry Lipperini, who we work very closely with. So please convey our regards and thanks to them as well. Our final speaker is the person responsible for organizing this entire webinar, my colleague Meredith Whitmire, who is the Policy and Advocacy Director for the Defeat Malnutrition Today Coalition, along with many other titles, but that's the one that'll work for today. So Meredith, it's all yours.
Thanks. So as promised, I wanted to show you the current co-sponsor list for Senate Resolution 716. Currently, this list is growing. This does not include Senators Grassley and Murphy. This is everyone else. So if you see your senator on here, send him or her a thank you note. If you do not see either or both of your senators on here, please contact them to ask them to co-sponsor the resolution. If you need help contacting them, please let me know. My email will be up at the end of this, so we can get you in touch. I also wanted to plug our National Blueprint 2020 update. We first published it in 2017, and it has, for now 3 years, provided a comprehensive review of the malnutrition landscape in the older adult. It's offered potential actions to improve health outcomes for older adults by addressing malnutrition, and its update was completed in early 2020. So if you haven't checked out the 2020 update, please do so. It's on our website at defeatmalnutrition.today/blueprint. And the update, if you've read the first one, the update will look pretty similar. We wanted to bring the science up to date. We got rid of some references that were outdated and added in some of the new stuff that has happened since 2017, which there has been quite a bit if you've been following along with our webinars and Aspen and the Academy's webinars. And we even brought it to press just after the pandemic started. So there are some references to COVID-19 in there and the amazing advances of telehealth. So we're really excited about it and hope you do check it out. I, like most of our other speakers, am going to go a little short today. We had allotted a lot of time, but now instead I would like to allot a lot of time for questions because we still have most of our speakers on the line, and there was a lot of information presented in a very short amount of time. So one question that we've received a couple of times in here, yes, you will be sent slides in the recording. I will send that out after it is done and processed to everyone who registered for this. Judy, there is a question for you. One questioner wants to know if you can provide any of the resources you shared during your talk.
I would be glad to do so. That makes a lot of sense. I did throw out a lot of new information, certainly.
All right. I can either put you two in touch, or you can shoot me an email and I can send information out to the broader group, whichever you prefer.
Yeah, it'd be great to get it out to everyone. Thank you.
Great. So this question might be, I think, for Ainsley and Judy. I'd be interested to hear both of your responses to this. What malnutrition screening tool do you recommend for community RDNs?
Well, Judy, I'll start. The Academy of Nutrition and Dietetics performed a systematic review over the last year and a half, and actually from that review created a position statement indicating that the malnutrition screening tool is recommended for use in all care settings. And so that would include the community. although Judy, I would love your impact. I know you talked about nutrition screening in a lot of the different descriptions that you provided. I know in Ohio, in Columbus, I've been working with Columbus Senior Malnutrition Group, and one of my colleagues of that group is actually going to participate in the malnutrition awareness webinar tomorrow with you, Meredith, and he's going to describe the work that this group has done with a charitable pharmacy population in using the malnutrition screening tool. So that was a long answer to that question, but the Academy's position statement clearly says MST is recommended for use in all care settings.
Thank you for giving that overview, Ainsley. I think that certainly we concur with that. I also find, having recently worked in the community and directly with community providers, that it also depends on the expertise you have on staff. You do want to be sure that you've got an established referral network so that you're identifying people at risk for malnutrition, but then you're able to assist them with identifying appropriate resources for them. And that's more than necessarily simply having an RD on staff. That's always helpful. You can also refer people to an RD and their physician, but many other programs and services can be beneficial for addressing malnutrition. I mentioned Shauna Marceau in Meals on Wheels of Central Texas. They use, the M&A. They have a different approach, and so I think it depends. It depends again based on your resources, the staff that are administering the screen, the length of screen. We chose to use the Screen 2, which is an incredible, lovely resource because it could also be used as a teaching tool. So it asks things like, do you eat alone? Do you prepare your own meals, or does someone else prepare for you? And so people were able to learn from the screening tool what might put them at malnutrition risk. But that's for the purpose of providing a class and a screening. So both, it depends on who you have on staff, the expertise, the resources and referrals you have, and then also just the setting that may be involved.
Thank you so much. I know that is a question we get all the time. So hearing multiple perspectives on that is really helpful. Judy, this question is for you, and it is a great question. Are there any specific plans through ACL to target rural seniors who may not have access to the internet during the time of COVID to make sure that they have access to meals?
Oh, there's a lot going on, and through individual states, through area agencies on aging, and local service providers. Our role at ACL is to encourage and provide guidance, but it's really your state unit on aging, your area agency on aging, and your local provider who's really working within your community to figure out solutions to provide meals. There can be anything from some delivery even by FedEx to I mentioned earlier, drive-by, pickup, grab and go settings. Typically what many of our programs are utilizing are frozen meals, again, so that there can be a little bit less frequent drops of meals than usual. We also really encourage partnerships. So we provide meals, our programs generally provide meals, and there are other ways to secure groceries. There can be grocery store shopping that can be done. There can be referral to USDA programs such as the Commodity Supplemental Food Program. So the Older Americans Act Nutrition Program is a vital program for providing meals to older adults. It's not the only resource that's out there for older adults who are experiencing food insecurity or malnutrition, and so thereby we're working together. with our partner organizations.
Great, thank you. This question I think is Ainsley, but Judy, if you want to pipe in on this too, that would be great. What is the clinical measure that is measuring success in vanquishing malnutrition? What works and how can we document it? So that
Oh,
is
gosh.
a large question to unpack.
Well, I will defer in terms of measures. I'll make reference to the clinical quality measures that the Academy of Nutrition and Dietetics and Avalier Health with MQII have been developing over the last several years. And that involves, those are specific to 4 measures, one involving nutrition screening, one involving nutrition assessment, one involving documentation of malnutrition in the medical record or the health record, and then documentation of a care plan. So within each one of those measures, there are processes that can be created to measure the success of achieving each one of those measures. That's a very simple answer to a very detailed question. Hopefully, I know the Academy has, along with Avalier Health and MQI, have worked together to develop a composite measure score that has actually been submitted to CMS and I believe is under the measures, the list of measures under consideration. So there may very well be in the next few years the requirement of a single measure that can be in a composite manner that can be utilized to for hospitals to report their success or their efforts with that specific composite measure and how that is reflected within their own healthcare system. I'm sorry, that's a really simple answer, but it's a very could be a very long process question, certainly.
Yeah, that is a great concise answer to a very large question. I feel like there are probably textbooks out there that could be written about that question. So thank you. Does anyone else have any questions or comments? Please send them in through the question box. I wanted to start questioning a little early because we had them coming in pretty furiously, but it has slowed down. So if anyone else has any questions for our fantastic panelists, please send those in now. Oh, here we go. Is there a possibility to fund interventions to make changes in the OAA to improve outcomes from COVID? It would be a good opportunity to pilot interventions underway linking outcomes with risk for malnutrition in older adults and those with disabilities. That's a Judy question.
Well, that's really a terrific research question to be asking, and we do have annual Innovations in Nutrition grants. Each year, we just awarded a number of them in September of 2020, and an announcement for next year's grantees will be issued probably in the spring or early summer of next year. And so we would encourage ideas like that to be submitted. So keep your eyes open for Innovation in Nutrition Services and Programs grants under ACL.
Let me add on that note, those grants actually are not only innovative, but they're timely. And, some of the projects they've been funding, have crept into the pandemic period with some programs that people have begun. And I think it's important that information be shared as much as possible about what people are doing in response to the pandemic. There's a lot of creativity going on out there under very difficult circumstances. And that can also help in the advocacy efforts to continue to secure adequate funding for these programs.
Absolutely. That's something that I always enjoy hearing about, the emails I get with folks who are very modest about what is actually a great innovation. I think a lot of programs think, oh, well, if I'm doing it, then other people must be doing this. It's a no-brainer. But in fact, so many programs across the country are so innovative that you know, chances are you are doing something that's pretty unique. So, you know, just keep passing on those stories. They're fantastic. One person asks where they can find more information about the funding opportunity. So Judy, where on the website could they find the information once the funding is posted?
Everything goes out on acl.gov.gov, and you can also sign up to be on notices for grant announcements and other information that ACL is sending out.
Great, thanks. This question is for both of us, Bob. Surprisingly, we get a question. How long should we be requesting support from our senators for the resolution? You know, since the Senate's not going to be in session this week, you know, they will probably not be able to take a vote on it this week. Why should we continue to ask for support, and you know, how does that go, so to speak?
Well, the reason we asked for the support is because the Senate unexpectedly went out of session this week, as many of you know, because of the spike in the number of COVID cases affecting United States senators. And the resumption of the Senate session the week of October 19th does not preclude the ability to pass the resolution, even though we're past the actual Malnutrition Awareness Week. It is not unprecedented for resolutions of this kind to get passed after the fact if schedule changes happen as they did here. So our point is that the more people get on who co-sponsor the resolution, the better the prospects of actually getting it passed. And we still want to see it passed. I know Aspen wants to see it passed. I'm sure Senators Murphy and Grassley want to see it passed. But the case is made considerably better if more senators join on as co-sponsors, because that signals their support for the resolution and what the resolution calls for. So it's just a scheduling, unexpected scheduling situation that led us to where we are now. But just treat the week of October 19th as you would this week in terms of this resolution.
Yeah, I agree. And I would also say that the more support we get this year, the more that builds on itself for next year. So, you know, last year, I think we had about 15 co-sponsors. This year, we already have more than that. So, you know, it's important to keep building awareness and keep building the support for Malnutrition Awareness Week. Are there any further questions? These have been some good conversation topics. Thank you, everybody.
Yes, and thank you very much, Meredith, for the work on this. And I will take this opportunity to thank Congresswoman Bonamici, Sarah Shapiro, Evelyn Fortier, Ainsley Malone, and Judy Simon, and Meredith Whitmire for contributing their time and talents to this webinar. And you know, we urge you to the resource page we have up there. And any other questions that you have, you can either email us or go to our website. We have no quarrel giving you back 5 minutes of your day.
Absolutely.
So I think with that, we will say thank you and best of stay well and stay healthy, and we'll be in touch.
Yes, thank you, everyone.
Thank you, Meredith. Thank you, Bob. Thank you, Judy.
Thanks, everyone.
Bye, everyone.
Bye-bye.
Bye-bye now.